For the room preparation, we have to tidy up the X-ray room before receiving any patient, ensure all the availability of the immobilization aids, for example, the grid, the stool, then prepare the protective shielding, for example, the gonadal shielding, and prepare enough and suitable image of the image receptor or the IR, set and center the tube to the table or the erect bucky. Hi, Assalamualaikum warahmatullahi wabarakatuh. My name is Rajana Batisha and today I'll be doing the projection for PA reads. So first of all, we have to do the patient identifications. First of all, we have to call in the patients by his or her full name, check the date of birth, check the registered number, and check all the information that is stated in the folder. So for the correct examination, we have to ask the patient or reconfirm with the patient the site or area of interest. Well, if it is different than stated, then we must consult the referring physician. To prepare the patient, first of all, we have to introduce ourselves as the radiographer, explain the procedures that we need to do to the patient, offering the opportunity to ask any questions to us before we proceed. Then if the patient is female, then we have to ask about the LMP or the last menstrual cycle according to the 10-day rule. This is to check any possibility of the patient's pregnancy. And we have to ask the patient to remove all the radio opaque objects on the body, such as the watch, the bra, and the jewelry. Then ask patient to change into the hospital gown, but the opening is at the back of the patient. Then we have to assist the patient to the erect bucky or the table. Then we have to explain all the breathing techniques or the procedural instruction to the patient.
For the cassette size, we're going to use 35 times 43 centimeter, which is the largest cassette size. And for the orientation, lengthwise or crosswise, depends on the patient's body habitus. Secondly is the KVP. KVP, we're going to use ranges from 60 to 80, and the MAS is 10 to 20. And for the SID, we're going to use 100 centimeter for recumbent position and 180 centimeter for the erect position. Grid is used in evaluating PA ribs. For the PA ribs projection, patient can be in upright or in recumbent position. So for the upright position, first of all, we must ask patient to face towards the erect bucky. Then hands of the patient is on the lower hips, palms out, and elbow is partially flexed. Make sure the chin is raised and align the mid-sagittal plane perpendicular to the image receptor or the IR. Rotate the shoulders anteriorly and depress downward in order to move the clavicle below the apices. Make sure the top of the image receptor is 4 to 5 cm above the shoulder, and CR is directed towards the T7, which is 3 to 4 inch below the jugular notch, which is at level T2 to T3. Okay, so for the respiration, we're gonna ask patient to suspend at full inspiration in order to allow the diaphragm to move downward. To collimate, make sure we include 4 sides area of lung fields. For the recumbent position, make sure patient is in prone position. There is no rotation of thorax and also the pelvis. And rest head on chin. Mid-sagittal plane is aligned to the center of the table. Make sure the shoulder is rotated anteriorly and depressed downward. And also the CR is directed towards the T7, which is 3 to 4 inch below the jugular notch, which is at level T2 to T3. Like this. Okay, so for the below diaphragm projection, it's similar with the above diaphragm, but only the difference is at the center ray, the collimation, and the respiration. For the CR, we're gonna do at the level of the midway between the C4 process and the 12th rib cage, which is the lower rib cage. So this is the level of the CR. Then for the collimation, we're gonna include superior to T9, which is this is the superior to T9 and inferior to the 12th rib or above the iliac crest. So for the respiration, we're going to ask patient to suspend at full expiration in order to allow the diaphragm to move upward.